everyone, my name's Cass and this is Ash and Edwina. The purpose of this presentation today is to discuss the current best practice of service delivery issues in Indigenous women's health and the impacts of the social determinants, the closing the gap policy, and how this undermines the health of this population.
Based on these key findings, 3 recommendations will be made for Access Brisbane to improve the outreach services for Indigenous women. These include a mobile healthcare education service, birth and on-country, and reliable transport.
Indigenous women experience poorer health outcomes due to certain social factors which negatively affect their health, including prenatal care, socio-economic position, housing and food security, residential environment, social exclusion, and social capital.
Indigenous women are 2.5 times more likely to be diagnosed with cervical cancer
And have a 1.2 times higher breast cancer mortality rate.
Also have a 2.8 times higher rate of chlamydia, and 80% of STIs were found in remote and very remote communities.
Indigenous women are more likely to have lower levels of income, employment, and education. These factors make them less likely to be in good health compared to those of higher income groups. There is a significant link between lower socioeconomic status and risky healthcare behaviours, including smoking, substance abuse, and poor nutrition. These are reflected in the statistics which graph the relationship between employment rates and certain risk factors in Indigenous communities. The Australian Human Rights Commission has highlighted a connection between low socioeconomic status and poor infant diet and a high risk of smoking and substance abuse during pregnancy, which can lead to low birth weights. Other risk factors include poor antenatal health, socioeconomic disadvantage, and obesity. Furthermore, babies born with a low birth weight are more vulnerable to developing health complications in childhood and adulthood, including type 2 diabetes and cardiovascular diseases.
Food insecurity is closely associated with low employment and educational levels and poor access to nutritional food, causing individuals to resort to less healthy alternatives. These barriers are more common among socio-economically disadvantaged populations, including Indigenous women, and increase the risk of developing health complications. Likewise, Indigenous women living in rural locations are subject to a higher risk of housing insecurity, leading to even lower rates of employment, education, and community involvement. The residential environment influences access to basic goods and services through local resources and behaviour. A community's social cohesion, promotion of health and well-being, and access are major health determinants. As the Australian Bureau of Statistics highlights, the majority of Indigenous Australians are located in regional or remote areas, which increases the likelihood of Indigenous women experiencing challenges in accessing basic goods and services.
Social exclusion is created by the power imbalance between economic, political, social, and cultural status. These play parts in many aspects of individuals' lives. This could be on a macro level, for example, affordable education, equal employment opportunity, or cultural and gender norms. On a micro level, this could mean income, occupational status, social networks, including gender, race, or religion. These fundamental foundations to the basis of exclusion underpin an individual's social capital discussed in the next slide.
Social capital is the ability to secure benefits by virtue of membership in social networks and other social structures. The ties that bind a social group together may also exclude others and therefore tie back to social exclusion. In the case here, it might be remote Indigenous communities' access to care as opposed to non-Indigenous urban communities' access to care. Social support can negatively influence individuals due to the increased stress from the demands of those groups. Behaviours such as smoking, for example, could be health damaging. The diagram shows how connected an individual's life experiences can have on distribution and access to services and the impact of social determinants of health. This enhances the reasons why trust, resources and access are so important to facilitate positive health-enhancing behaviours.
More than 12 years ago, Aboriginal and Torres Strait Islander people campaigned to close the gap in life expectancy. The government responded with a commitment, the Closing the Gap Framework. Since then, Aboriginal and Torres Strait Islander people have continued to shape our country's future, creating opportunities for education, employment, and economic development.
Of the 7 targets, currently 3 are on track. Based on this, 3 recommendations will be made regarding the best way for ATSICs to provide culturally safe care for women.
Recommendation 1 is a mobile healthcare and education outreach service for women in rural and remote areas. This will provide more specialised follow-up care, which will improve the continuum of care and boost the management of Indigenous women's health. The goal is to minimise limitations and complications which stem from this population's lack of access to healthcare. It therefore aligns with ATSIC's mission to provide practical care at early intervention levels through a tailored and integrated service, which addresses the continually changing needs of their clients' population. It will empower Indigenous people by supporting social inclusion, being community driven, and focus on women's health, such as pregnancy care and sexual health education. This contributes to the education and life expectancy of closing the gap targets. Therefore, this mobile education service will focus on prevention and education through a holistic and approachable outreach.
Recommendation 2 is providing birthing on country opportunities by ATSICs. The graph outlines comparable evidence from Indigenous communities across the world, which shows that birthing on country is directly related to reducing low birth weight rates. These outcomes significantly impact child mortality and life expectancy, which are outlined by the Closing the Gap targets as priority areas in the Indigenous population. This recommendation relates to ATSIC's statement to empower Indigenous people within their community to take back control of their own health and community well-being. While the definition of risk in terms of medical and clinical aspects is important, the impact that social, cultural, emotional, and spiritual risks have on health outcomes is a valid dimension requiring greater focus.
Recommendation 3 is to ensure reliable transportation to specialist services which aren't available in rural and remote areas. This would increase Indigenous women's incentives to access healthcare services and will be most effective through combined planning and communication with Indigenous communities. This aligns with the ATSIC's mission to provide care that meets the evolving needs of their clients to enhance healthcare outcomes and service reachability. This reflects a bold and inventive solution to promote access to healthcare and build partnerships with other services such as local transport to enhance healthcare in remote locations.
In terms of overall recommendations for ATSICs, cultural safety is the highest priority for all health practitioners practicing in any Indigenous health services.
We recommend ATSIC focus on providing a holistic, welcoming environment free from judgment and prejudice, focusing on the positive despite the disease burden and allow women the freedom to choose their services and actively participate in healthcare.